Did you know that nearly 50% of adults over 65 experience insomnia? Sleep isn't just about rest, it's about healing, memory, and emotional balance. In this video, we'll uncover the real reasons why so many seniors can't sleep. And more importantly, how to fix it, naturally and effectively. 1. Causes of insomnia in the elderly. Insomnia doesn't have to be an inevitable part of aging. But in reality, many older adults find it harder to fall asleep or stay asleep throughout the night. So, what's really keeping seniors awake? Let's take a closer look. Natural changes in the body's internal clock. As we age, our biological clock, also known as the circadian rhythm, begins to shift. Older adults tend to feel sleepy earlier in the evening and wake up earlier in the morning, often after just 4 to 5 hours of sleep. This isn't always true insomnia, but the shorter sleep duration can leave seniors feeling tired and low on energy during the day. In addition, aging reduces the amount of deep sleep we get. Deep sleep is essential for restoring both body and brain. Without it, the sleep we do get feels lighter and more fragmented. Underlying health conditions that disrupt sleep. Many seniors live with chronic health conditions like arthritis, back pain, heart disease, diabetes, or Parkinson's disease. These health issues not only affect overall well-being but also cause discomfort or pain that interferes with sleep. For instance, people with diabetes may wake up frequently to urinate. Those with acid reflux may feel burning sensations when lying down. All of these conditions prevent the body from fully relaxing and make it harder to fall asleep or stay asleep through the night. Side effects of medications. Older adults often take multiple medications daily, a situation known as polypharmacy. Some of these medications can interfere with sleep. For example, diuretics cause nighttime urination, corticosteroids can make you feel wired or alert, and certain heart medications may cause irregular heartbeats that disturb sleep. Even common over-the-counter drugs, such as antihistamines or painkillers with caffeine or pseudoephedrine, can stimulate the nervous system and disrupt your ability to sleep well. Mental health challenges. Seniors are more likely to experience loneliness, sadness, or anxiety, especially after retirement, the loss of a loved one, or reduced social interaction. Mild depression and generalized anxiety are often hidden causes of insomnia in older adults. Many don't even realize their emotional health is affecting their sleep. Instead, they simply report trouble sleeping, without realizing that unresolved emotional stress may be at the root of the problem. Sleep disorders that often go undiagnosed. Older adults are at higher risk of developing sleep disorders such as sleep apnea, a condition where breathing stops and starts during sleep, often causing loud snoring and fragmented sleep. Restless leg syndrome, RLS, a neurological condition that creates uncomfortable sensations in the legs and an irresistible urge to move them, especially at night. Chronic insomnia. This refers to difficulty sleeping that lasts more than 3 months and occurs at least 3 times per week. Unfortunately, many seniors are unaware that they may have these conditions. They may assume poor sleep is just a normal part of aging and learn to live with it instead of seeking help. In summary, insomnia in older adults results from a complex combination of physiological changes, chronic health issues, medications, and emotional challenges. But here's the good news: most of these causes can be addressed once they are recognized and properly managed. 2. Underlying health conditions that cause sleep disturbances in the elderly. As we age, it's not uncommon for sleep to become lighter, shorter, and more easily disrupted. But sometimes, poor sleep in older adults isn't just a result of getting older, it's caused by underlying health conditions that affect both the body and mind. Let's take a closer look at some of the most common medical issues that may be quietly sabotaging a good night's sleep in the elderly. Chronic pain. One of the most common reasons older adults struggle to fall asleep or stay asleep is chronic pain. Conditions like arthritis, osteoporosis, and nerve damage from diabetes can make it uncomfortable to lie in one position for too long. Even low-level pain can keep the body in a state of alertness, preventing the deep, restorative stages of sleep. Pain doesn't just interrupt sleep, it can also make people anxious about going to bed, especially if they associate lying down with discomfort. Managing pain through proper treatment, gentle exercise, and mindfulness techniques can significantly improve sleep quality. Cardiovascular issues. Heart disease, high blood pressure, and congestive heart failure are common in older adults and can all contribute to sleep disturbances. People with heart failure, for example, may experience shortness of breath when lying flat, a condition known as orthopnea, which makes it hard to fall asleep. Also, medications used to treat these conditions can sometimes cause side effects like nighttime urination or increased heart rate, which disrupt sleep patterns. That's why it's important for patients to review their medications with a healthcare provider regularly. Urinary problems. Benign prostatic hyperplasia, BPH, in men and overactive bladder in both men and women can lead to frequent trips to the bathroom at night. This condition, known as nocturia, is one of the leading causes of fragmented sleep in the elderly. Even waking up once or twice in the night can prevent the body from completing full sleep cycles, leading to grogginess, memory issues, and daytime fatigue. Managing fluid intake, especially in the evening, and treating urinary conditions with proper medications or pelvic exercises may help. Respiratory conditions. Conditions like chronic obstructive pulmonary disease, COPD, or asthma can also interfere with sleep. Nighttime coughing, wheezing, or difficulty breathing can awaken someone from deep sleep or make it hard to fall asleep in the first place. In some cases, supplemental oxygen or adjusting the sleeping position may help relieve symptoms and improve rest. Neurological and mental health disorders. Depression, anxiety, and even early signs of Alzheimer's disease can show up as sleep disturbances. People with depression may either sleep too much or not enough, while anxiety can make it difficult to turn off the brain at night. In dementia patients, something called sundowning, confusion and agitation in the evening hours, can cause restlessness, wandering, and insomnia. Supportive routines, calming environments, and professional guidance are crucial for managing sleep in these cases. In conclusion, sleep isn't just a nightly ritual, it's a mirror of our physical and mental health. When sleep becomes a struggle, it's often a signal that something deeper may be going on. By identifying and treating the underlying medical conditions, many older adults can finally get the restful, healing sleep they truly deserve. Insomnia doesn't have to be a normal part of aging. With the right steps, seniors can enjoy restful nights and brighter mornings. If you or a loved one is struggling with sleep, try these simple tips and share this video to help others too. Don't forget to like, subscribe, and hit the bell so you won't miss more health tips from Health 999.